The Kadlec Regional Medical Center of today is vastly different than the Kadlec Hospital of 1944. Kadlec in 2014 is an integrated regional healthcare system with more than 2,700 caregivers, serving patients across a two-state area of the Pacific Northwest. Kadlec's service area is approaching 500,000 people throughout southeastern Washington and northeastern Oregon.
A number of the services that we provide are the type where time is critical. And if you have to travel to Spokane, Portland, or Seattle to receive those services, you will have lost vital heart tissue or brain tissue. Service close to home is vitally important for outcomes. And I know there are people in our community who are alive today and healthy today because of things we've been able to do from programs we started over the past 15 years.
Kadlec is named after Lieutenant Colonel Harry Kadlec, a member of the U.S. Army Corps of Engineers, the agency charged with building the Hanford nuclear site in the early 40s as part of the ultra-secret Manhattan Project. Kadlec's role was to build the infrastructure to support the 50,000-person workforce that invaded this arid region along the Columbia River. In effect, Kadlec's role was to build what is today Richland. 70 years later, Kadlec is a thriving healthcare organization in a growing Tri-Cities community, with exclusive regional specialty services such as cardiology, neurosciences, neonatal intensive care, and a robust Kadlec clinic provider base approaching 150. Kadlec is a member of the prestigious Plaintree network of hospitals dedicated to holistic, patient-centered care. We are one of only 55 hospitals in the world to hold Plaintree designated status.
Our commitment is first and foremost to the patients in our community and those in the area surrounding our community. We have all the services that you might expect in an urban community in this supposedly rural portion of the state, and we do a very good job of it.
Well, the greatest sense of satisfaction for me is what we've been able to do for our community, and the number of people who are so much better off as a result of what we do.
What has that commitment meant to the most important constituencies, our patients and caregivers? Pride, gratefulness, emotion.
I've been a nurse for over 30 years. I've worked at Kadlec all these years. We've taken on treating childhood cancers. I did some special training and became an oncology nurse, and it just really has been a blessing to me to be able to serve these patients and these families. I'd like to thank Kadlec just for the privilege it's been to work here, and I truly mean that from my heart.
The reason that I came to volunteer here at Kadlec is I had brain surgery. I really feel without Kadlec's help in that, I wouldn't be here. And I thought, if there ever comes an opportunity for me to work there as a volunteer, I would to. I know I wouldn't be here if it wasn't for Kadlec.
As the landscape changes and uncertainties present significant challenges to our nation's healthcare system, Kadlec has been considering how long it can sustain its momentum as a standalone organization. Thoughtful and deliberate research and study led to an affiliation with the highly regarded Providence Health and Services.
We believe Providence is the organization that's going to be around for a long time. We think that by joining Providence, this institution has the best probability of serving this community in the best manner possible for the longest time. It's the best way to go for our community.
Both Providence and Kadlec have a commitment to community-based health care and serving our patients with high-quality care, the best we can provide. And that commitment to our patients, the whole patient, not just that procedure, not just that illness, but the whole patient experience is something that both Kadlec and Providence have a commitment to.
So as Kadlec embarks on its 71st year, it comes at an exciting time. A time to reaffirm a commitment to providing the highest level of care possible to the patients we serve. It is a commitment we are honored to meet as the newest member of the Providence team.